Hey everyone, we are doing something different today and we are coming at you live. I'm Casey, I'm part of the admin team here at Carevide, and today I am joined by our Director of Behavioral Health Services, Jocelyn Pratt. How are you, Jocelyn?
I'm good. It's been a really busy Friday so far, so
That's
looking
awesome.
forward. Yeah.
It's been a good week. It's been busy because it's National Health Center Week. It's a week where health centers across the nation celebrate and kind of raise awareness for all the work that health centers do. And so we've just been posting like crazy, trying to get the word out about everything that our staff and everybody does. Because that kind of goes along with the theme. Our theme of National Health Center Week this year is community health centers lighting the way to healthier communities today and in the future. So we've kind of been jumping on that theme with, trying to spotlight different services and centers and providers and stuff like that. And so that's kind of where this video came from. So we wanted to kind of shine that light on our new behavioral health program. Before we get into that, though, I just kind of wanted to give you a chance to introduce yourself. I know a little bit about you because before our paths came together at Carevide, we kind of crossed paths in our previous lives.
Right.
But tell us a little bit about yourself and just kind of how you ended up at Carevide and what you do here at Carevide.
Okay, so I am a clinical social worker in LCSW. I've been doing social work for 7, 8 years now. Kind of been all over the place. My first job was at Hunt Regional Medical Center in Greenville in the emergency room doing patient navigation. Then I went off to Dallas and worked at Parkland and then out in the community, and decided, you know what, let's get back to East Texas. I really enjoyed working out there.
Mm-hmm.
And so now I'm put in Kaufman, and I love it out here.
And so you just listening to that, like you really have a lot of experience working with vulnerable populations, especially I can imagine at Parkland, seeing some of the most vulnerable, and so I think that that's really a strength that you bring to this, knowing that Carevide being a community health center, we see patients on all, different socioeconomic status, insured status, all of that. So, we serve some vulnerable populations as well. So I think that's a strength kind of coming in. So let me just jump right into it. As Director of Behavioral Health Services, can you just kind of tell us about the behavioral health program that we have at Carevide? I know it's something new and I know it's changed a little bit recently, and just a lot of people don't know what behavioral health means or what you guys cover or talk about or whatever. So will you just kind of give us just a general kind of rundown of what that program is?
Sure. So behavioral health integration, that's the fancy title. It places a social worker or an LPC in the patient's primary care clinic. I see everybody. I'm not just working with kids, adolescents, adults. I work with everybody. Anybody that walks in that door as a patient, I can see them. I work mainly off of warm handoffs. So you're seeing your primary care physician and they realize something's going on, or even you ask to speak with behavioral health. They come get me and I am in there right then and there during your primary care appointment. So you don't have to make an appointment and come back. It's right then. So it's really convenient. The goal of the program is to be there for our patients right when they need us. So that also includes same day or walk-in. So yeah, it's really great. And it's been a great program so far. I have people that I haven't talked to them for months because they've been okay, but then COVID or life happens and they give me a ring and they're like, hey, can I come in? And my schedule stays open on purpose so that I can say, yeah, come on in here in an hour or whenever you want this afternoon. So it's really a wonderful program.
So when you get into these patient rooms, what does that look like? What do you do with them? A lot of times, we talked about this earlier. A lot of times people think with behavioral health, like, oh, I'm going to therapy, or I've got to spend an hour talking to this person, every week or whatever. When you go to meet with that patient, they're in the site. What does that look like? What do you guys talk about? What do y'all do?
So first visits, well, most visits actually last 15 to 30 minutes. So they're short and sweet and to the point. Sometimes they last longer, and that's okay. It's whatever the patient needs, but it's 15 to 30 minutes. First visit, I ask a lot of questions, and really it's just getting to know you as the patient, what's going on in your life, because nobody knows that better than you. I do a screening to look at your physical, mental, and social health, because that's what we focus on mostly. And then from there, we look at the symptoms that you're having. What have you tried to manage these symptoms? What works? What doesn't work? When are the symptoms worse? When do they get better? All of that good stuff. And then by the end, we come up with a game plan. So to go through things that you'd be willing to try. That could be relaxed breathing, mindfulness, progressive muscle relaxation, all the way over to goal setting. You want to lose some weight, make healthy lifestyle choices, but are having a really hard time putting some steps into place. That's what I'm there for. Just come up with things that work for you, because we all know that it's hard, especially during COVID, when we have to stay inside, and we just kind of lose track sometimes of our goals. And so having somebody that can come in there and sit with you and work through this is really, really helpful. So I work with all kinds of things. And you did mention, don't think of me as a therapist or a counselor. We had another title called health improvement practitioner, which I really loved. And that's just what it is we want, as a team, your primary care team, to improve your health. And that doesn't just mean anxiety or depression. That means I'm just stressed out because COVID is nuts. Yeah. And I'm stuck inside the house with my family when I used to be able to go do my own thing. Or now I'm eating a lot of junk food, and it's really hard to not eat junk food. Or I want to exercise more, but my gym's not open. So all kinds of different things. It's not just anxiety or depression.
See, that was one of the things I was going to ask about, like if there had to be like a diagnosis or it was just certain things. But it sounds like that, if a patient comes in and they're having a hard time, whether it's, related to a specific like mental health diagnosis or whatever, that basically you're kind of a tool to help them kind of get through whatever they're going through. Absolutely. And I think that sounds, to me, that sounds like a huge, that's a very exciting thing to be able to offer to patients, to say, so you're here to see your doctor, to your provider, to take care of your physical health. But it sounds like you're stressed out or you're having a hard time. We have another tool to help you. And I think that just kind of is one more thing to kind of add to the way that Carevide really tries to take a holistic approach to helping people. And so I love that. You kind of mentioned this, and so I'm just going to maybe kind of put you on the spot a little bit here, but any kind of words of wisdom or tips for people who are stressed out during COVID right now? I know you did a video for us, a little while back, but just, any kind of quick little things that we can just kind of send people, out with that it is a stressful time. And so here's maybe something that they could do to kind of ease that a little bit.
Yeah, absolutely. And definitely, if you didn't already, go check that video out. It has some really great tips. But the first thing I always tell my patients who are really stressed out from COVID, and staff here too, let's take a deep breath and understand that it's normal and it's natural to feel this way. And make sure that you do take some time to yourself and do something that you enjoy that makes you happy. Self-care is so important right now for us. And so even a small thing, whether that means take 5 minutes to go stand out on your porch and just take a few deep breaths. But that's my main one: breathe. Yeah. Be nice to yourself. We're all stressed out. That's normal. It's natural. That's one thing that we are all experiencing right now, is some serious stress in life. Yeah.
The world's just so different right now. So I think it's pretty natural for people to be a little stressed, or just to kind of not really sure, where they are with things, just kind of dealing with things. So just anything else you want to, send out to patients or to let patients know kind of about you, what you do, the program, anything like that before we hop off?
Just again, don't look at the program or talking to a behavioral health specialist as a therapy or that something is wrong with you. That's just simply not the case. Everyone in their life needs at some point to talk to somebody. And sometimes that's what I do. Sometimes a person's like, can I just sit and talk to you?
Yeah.
We don't need to plan anything. I just want to vent. And so look at it that way. I hear all the time people are like, I'm not crazy. No one's saying you're crazy, I promise. Coming from somebody who I have my own therapist and I have my own person that I talk to. We all need it at some point, point in our life, especially right now. The world is crazy. And just be kind to yourself. And if you need anything, you know where I'm at.
Yeah. Well, and my undergrad is in social work as well. And that was one thing that they really stressed to us is that, like, it's okay to take care of yourself. We, even as practitioners, even as, staff and whatever, it's important to take care of yourself, to give yourself grace, to just kind of breathe through those moments and know that, we've all experienced those times in our life.
Yep.
Well, I appreciate you coming on today, doing this live with me, just to kind of let our patients know about the program. And then, so to everybody that's watching, thanks for tuning in. If you like these videos that we're doing, let us know. We might do some more in the future. But thanks for watching. Thank you for coming on, Jocelyn. And we will say goodbye.
Bye, y'all.